All right, let's hustle out there.
Have you ever had a nosebleed? Maybe from blowing your nose too hard? Or how about from getting hit in the nose with a ball?
Okay, you're going in next. I want to see what you can do.
Coach, sorry, Coach.
Hey, Bobby tipped it and the ball just came your way. Need some help?
Yeah, I need some help.
Hey, Angelo, go get the first aid kit from the gym office. No, lean your head forward.
I thought I was supposed to hold my head back.
No. You don't want to lean your head back when you're trying to stop a nosebleed. Okay. I'm gonna pinch your nose pretty hard with this gauze. Maybe for several minutes.
Okay, I'm ready.
To stop a nosebleed, apply pressure and follow these first aid steps. As with other bleeding emergencies, first make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Have the person sit and lean forward. Pinch the soft part of the nose on both sides with a clean dressing. Place constant pressure on the nostrils for a few minutes until the bleeding stops. If bleeding continues, press harder. Phone 911 if you can't stop the bleeding in about 15 minutes, if the bleeding is heavy, such as gushing blood, or if the injured person has trouble breathing. Sometimes, when a person suffers a mouth injury, one or more teeth may have broken, become loose, or been knocked out. This can be a choking hazard.
As with other emergencies we've discussed, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment.
Then, follow these first aid actions that are specific to tooth injuries. Check the person's mouth for any missing or loose teeth or parts of teeth. If a tooth is chipped, gently clean the injured area and call a dentist. If a tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place and call a dentist. If a tooth has come out, it may be possible for a dentist to reattach the tooth. So when you hold it by the crown, the top part of the tooth, not the root. Apply pressure with gauze to stop any bleeding in the empty tooth socket. Clean the area where the tooth was located with saline or clean water. Put the tooth in one of the following: egg white, coconut water, or whole milk. If none of these is available, store the tooth in the injured person's saliva, not in the mouth. Immediately take the injured person and tooth to a dentist or emergency department. Eye injuries are fairly common when it comes to providing first aid. Any direct hit, such as a punch to the eye or chemical in the eye, can create big problems. If the eye is hit hard or punctured, phone 911 and tell the person to keep both eyes closed. If something small like sand gets in a person's eye, rinse with lots of running water. Phone 911 if the sand or object doesn't come out, if the person complains about extreme pain, or if the person still has trouble seeing. Tell the person to keep his eyes closed until someone with more advanced training takes over. If chemicals get in a person's eyes, also rinse with lots of water. Rinse for at least 15 minutes or until advanced medical care arrives. If an eye wash station is nearby or you have access to an eye wash kit, use it. If neither is available, use water from the tap or normal saline or contact lens solution and phone 911. If only one eye is affected, make sure the eye with the chemicals in it is the lower eye as you rinse. Try not to rinse the chemicals into the unaffected eye. Penetrating and puncturing injuries to the body are treated differently from more common bleeding injuries. An object such as a knife, nail, or sharp stick can wound a person by penetrating the body or puncturing the skin. If the object is stuck in the body, leave it there until a healthcare provider can treat the injury. Taking it out may cause more bleeding and damage. Follow these first aid steps for penetrating and puncturing injuries. First, make sure the scene is safe. Try to keep the injured person from moving. Get the first aid kit and AED. Wear personal protective equipment. Phone 911 and try to stop any bleeding you can see. One external bleeding injury that may seem overwhelming is traumatic amputation. Amputation occurs when any part of an arm or leg is cut or torn off. It may be possible to reattach amputated fingers or toes. And because of this, it's important to know first aid actions to first stop bleeding by using pressure and possibly a tourniquet, and then to protect the amputated part.
It looks like the bleeding has stopped. Austin, keep holding your hand like we told you to. I'm sorry, I know it hurts. I'm gonna put you on speaker mode so you can tell us what to do.
Okay. First, get plastic bags that you can seal and put ice in one of the bags.
Okay, I'll get the bags and ice.
Okay, we've got the bags and we've got the ice. Now what do we do?
You need to rinse the finger off in water and then cover it with clean dressing from the first aid kit.
Okay, just kind of wrap it?
Yes. And then place the finger in an empty plastic bag and seal it.
Okay.
Austin, I know you're hurting and upset, but it's gonna be okay.
Put a small amount of water in the bag with the ice. Then put the dry bag with the finger in it into the bag with the ice and water. But avoid putting the finger directly on the ice.
Got it.
Label the bag with your son's name, today's date, and the time.
Okay, I've got a marker, I'll do that.
Take care of the amputated part, rinse it in clean water, then cover it with a clean dressing and place it in a watertight plastic bag. Place the bag in another container with ice or ice and water, and label it with the injured person's name, the date, and the time. Make sure the body part gets to the hospital with the injured person. Remember, do not place the amputated body part directly on ice because extreme cold can injure it.